Hola, Pilipinas! Welcome to Eagle News Mornings from Canada. I'm Archie Rose, Natividad Yi, coming to you from Vancouver in the province of British Columbia, Canada, bringing you news and commentary from across the country. Here are some of the stories that we'll cover today. COVID-19 death toll surpasses 20,000 in Canada. Canada strengthens border measures. Hospital numbers to determine further easing of public health measures in Alberta. Ontario promotes mental health on Val Let's Talk Day. And in sports, Tokyo Olympics set to go in July. We start another week. Good Monday morning. As you're grabbing a fresh cup of coffee, here is what the weather looks like. First, let's check out Manila. AccuWeather is forecasting a high of 23 degrees Celsius with cloudy skies. Now let's take a look at the weather across Canada. Our weather street scene comes from Montreal, Quebec. Thanks to Marjorie Quintos for this video. Let's go across the country starting from the west coast. Vancouver, cloudy at 7 degrees. Edmonton, cloudy at -10 degrees. Calgary, mostly cloudy at 2 degrees. Winnipeg, partly sunny at -6 degrees. Montreal, mostly sunny at -13 degrees. Ottawa, mostly sunny at -13 degrees. Toronto, cloudy at -5 degrees. Halifax, cloudy at -1 degrees. And St. John's, New Brunswick, mostly sunny at -3 degrees. Now over to our top stories. Canada has now over 775,000 cases of COVID-19 as the death toll now surpasses 20,000. To date, there will have just been under 1 million Canadians residents who have received the vaccine. Despite government restrictions and curfews set in place in different parts of Canada, there is still a surge of outbreaks that continue to occur in high-risk populations and communities, including hospitals and long-term care homes, correctional facilities, congregate living settings, Indigenous communities, and more remote areas of the country, according to Dr. Teresa Tam, Canada's Chief Public Health Officer. As some provinces are considering easing measures, Dr. Tam continues to emphasize that provincial leaders must continue with applying restrictions in order to prevent surges of infection. It is crucial that strong measures are kept in place in order to maintain a steady downward trend. With still elevated daily case counts and high rates of infection across all age groups, the risk remains that trends could reverse quickly, and some areas of the country are seeing increased activity, said Dr. Tam. This response was a result of Quebec Premier François Legault announcing on Facebook that he was planning on making changes to Quebec's current public health protocols in order to, quote, be able to give some oxygen to retail stores. The changes would come into effect after February 8th, when the province-wide curfew is set to end. Non-essential businesses have been closed since December 25, and the province has been on an 8 p.m. to 5 a.m. curfew since January 9. Details will be announced at a press conference on Tuesday. The Government of Canada is strengthening border measures to help curb COVID-19 cases in the country. Here is Eagle News correspondent Andre Lajoie with more.
The Government of Canada is strengthening border measures. As the Government of Canada recently provided an update on our border, Prime Minister Justin Trudeau says starting today, non-essential trips to some destination will not be allowed.
The government and Canada's main airlines have agreed to suspend service to sun destinations right away. Air Canada, WestJet, Sunwing, and Air Transat are canceling air service to all Caribbean destinations and Mexico starting this Sunday up until April 30th.
Also, starting next week, all international passengers flights must land at 4 major airports in Calgary, Montreal, Toronto, and Vancouver, respectively. Trudeau says mandatory PCR testing will also be introduced at airports for passengers returning to Canada.
Travelers will then have to wait for up to 3 days at an approved hotel for their test results at their own expense, which is expected to be more than $2,000.
According to the Prime Minister, travelers then have to wait up to 3 days at passengers' expenses and approve a hotel location for their COVID-19 test result. Under an increased surveillance and enforcement, travelers with negative test result will have to quarantine at home for 14 days. People with positive result will be transferred to additional quarantine facilities. The new measures released by the government are in addition to the restrictions already in place. A negative test required for flying back to Canada, and mandatory quarantine is in place returning home, and borders remain closed to the foreign travelers. In Ottawa, Canada, this is André Lajoie for Eagle News. We live in interesting times.
Alberta is easing restrictions as COVID-19 cases falls in the province. Joining us live is Eagle News correspondent Thomas I. Likeness from our Edmonton Bureau to tell us more. Good morning, Thomas.
Good morning, Archie. Well, like you mentioned, the restrictions are easing a bit more in Alberta. The number of new cases of COVID-19 is beginning to fall, but that's not the measure they're going to use. Further lifting of health measures will depend on how many hospital beds in the province are being occupied by COVID patients. Alberta Premier Jason Kenney says, as pressure on the healthcare system is eased, more restrictions can be relaxed. So again, further relaxation will be based on the number of people in hospital being treated for COVID. Now, this will be done in 4 stages as the patient numbers decline. In the first stage, which will begin in about a week, well, one of the things that we'll be able to do that we haven't been able to for almost 2 months is dining in. That'll be allowed with up to 6 people at a table, as long as they're from the same household. Restaurants will have to collect contact information, and they'll have to shut down by 11 o'clock. Gyms will be allowed to reopen for one-on-one training, but group fitness and team sports still not allowed. Children's sports activities, however, if they're within the realm of a school, they will be allowed. Still banned private gatherings, so we can't invite friends to our homes for dinner and karaoke. And Kenny is warning he won't hesitate to bring back tough measures if needed.
If cases of COVID-19 surge again, if we start moving once again towards exponential growth like we saw in November, December, and if somehow one of these new viral variants takes hold in our community and begins to spread at rates seen in some other parts of the world, we will have to impose stronger restrictions again.
Now, an ongoing problem has been a small minority of people who feel, the restrictions violate their rights. What about these people who normally disregard existing health measures? Well, there's a large church near Edmonton that's routinely ignored the restrictions. They've been ticketed several times. Last week, some 230 people there, which was about 10 times the number that were supposed to be in there. No masks, no social distancing. Health department has stepped in now. They've closed them down. In northern Alberta, a group of local politicians, they patronized a restaurant that had reopened in violation of the measures. Why? These elected officials said, we just wanted to show our support for small businesses. What, Mr. Premier, do you say to these people?
To see people in elected government positions encouraging a flagrant disregard of public health measures during a pandemic like this is totally irresponsible. And when they do it, they are thumbing their nose at the ICU nurses who've been working around the clock. What they're doing is saying that their personal wishes outweigh the need to protect our healthcare system.
And protecting the healthcare system is what these measures are all about, because we desperately want to avoid the situation where we have to ration healthcare because there are not enough hospital beds to accommodate the demand. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times. Back to you, Archie.
Thank you so much, Thomas. Now, can you tell us how much did politics play in the decision to ease restrictions?
Well, this came up at the news conference that I saw with the Premier, and he says, of course, decisions are made on what's best for the province, no politics. But his government has been under a lot of pressure to reopen restaurants. You know, with the restrictions of allowing only 6 at a table, all from the same household, and requiring restaurateurs to document contact information, that's probably an acceptable compromise from a public health point of view. But just remember, whenever somebody says politics didn't play a role in this, you can bet they did. Archie?
Oh, definitely. Now, can you tell us how close is Alberta to returning to normal?
I'm going to give you an opinion here, and I'm going to tell you it's a long ways off. We've got a number of factors to consider. First, we have to control the spread of the infection. And at this time, it's still best controlled by limiting personal contact. We're still not allowed to have private gatherings in our homes. The next issue is immunization. But those plans may go out the window. Pfizer's decision to drastically reduce our shipments to Canada and the European Union making noise about putting export restrictions on Pfizer. This is really going to upset the timetables we had for immunization. So to meet that goal of the majority of people being immunized by September, that may be a pipe dream that goes up in smoke. And then there's the question of just how effective are these vaccines? How long is this immunity going to last? Against the original virus, the vaccines seem to be effective. But will the virus outwit science and evolve into a variant that becomes immune to the immunization? And as far as how long the immunity will last, only time will tell. More importantly, we still don't have a cure for this infection. The only treatment is symptomatic, and in many cases, that's not working out well. All in all, we still have more questions than answers. The biggest one of all is, should we be preparing for a third wave of this infection? Let's look at a little history. Spanish flu pandemic, that lasted from 1918 to 1920. So it's anyone's guess at this point as to when normality may resume. Archie?
Well, thank you so much for that, Thomas. It seems like there definitely is a lot of factors in play, lots of variables, so only time will tell. Thank you so much for joining us today. We are coming up at 7:17 a.m. You are watching Eagle News Mornings from Canada.
Ikaw ba ay may natatanging talento sa pagkanta? Ito na ang pagkakataon mong ipamalas ang inyong galing at manalo ng 2 million pesos. Tuloy-tuloy pa rin ang online audition ng Tagisan ng Galing Part 2.
Kaya kung ikaw ay 18 to 65 years old,
magpadala na ng audition video sa tagisananggaling@gmail.com or contact Nikki sa 0977-651-9504. Narito ang guideline sa paggawa ng inyong audition videos. You can also visit our Facebook fan page for more information. Sali na at maging bahagi ng pinakamalaki at pinakamalawak na talent competition on Philippine television and online. Tagisan ng Galing Part 2. Dito lang sa Net 25.
Welcome back. You are watching Eagle News Mornings from Canada. I'm Archie Rose, Natividad from Vancouver, British Columbia. It's 7:18 a.m. Joining us live from Honolulu is our Eagle News correspondent, Alfred Asenes from our Hawaii Bureau, for an update on the COVID-19 outbreak and impacts in his part of the world. Aloha, Alfred.
Aloha, Archie, Rose, and good day, good evening to everyone watching right now. You know, I haven't done this in a while. It is actual statistics on where Hawaii is. So let me just start off with that. So 82 new cases today, which is Sunday here, and we're inching closer to 26,000 cases total, and 410 fatalities to the virus. Now, I want to point out that as we're entering February, we're also entering the first month of our new mayor new mayor's administration here in Honolulu, Rick Blangiardi. And I want to show everyone the couple of charts that was set up by the previous administration of Kirk Caldwell. It depicts the tiered reopening strategy. And in our case here on the island of Oahu, we're in tier 2 as we speak. So in a nutshell, we try to maintain no more than 100 rolling average of cases and a less than 5% positivity rate. And then at the same time, you got some, according to that chart, that's I'm hoping it will come up. We're trying to limit the persons in restaurants and other establishments of no more than 5. Now, it can be out, you know, it doesn't have to be within the household. But what's significant here, Archie, is that the new mayor, Rick Blangiardi, is pondering and considering adjusting some of the policies that were set forth previously for the sake of continuing the momentum, especially in businesses, to continue their operations and not have to revert back to tier 1. So we're expecting, and really the big, what the expectation here is to have something as concrete as what you're seeing right now, updated so that small businesses, and especially other industries like the tourism industry, can look at it, use that as reference, and gauge on how safely they can resume, like expanding more flights here and opening up more hotels here throughout the island of Oahu. So that's where we're at right now. So we're expecting something, you know, more concrete in the month of February under the new administration for the mayor of Honolulu, Archie.
Thank you so much, Alfred. Now, you know, you're speaking in terms of changes that are being done to hopefully be able to supplement the other industries that, you know, like tourism. Do you have any visitor statistics that you can share with us?
Yeah, and the thing is, you know, it's a given that November, December, especially December, you would think that, oh, okay, there's going to be a little bit of boost, you know, in tourism one way or the other. Again, given the pandemic, given the lack of consumer confidence in flying in general, the state of Hawaii has put out a 75% drop of visitors in December compared to December of 2019. Which, yes, it's dismal, it's disappointing, but that should not be surprising to everyone. Compared to when we first started doing restrictions, you know, the percentages were in the 80s, even 90s when we first locked down. So is it improvement? You know, it's a number, so it's really open for interpretation. But I am disappointed. You know, with Canada, they had a drop of 94% in December. However, you know, we continue to open up travel, and I believe earlier this month, the state of Hawaii did open up pre-travel options for those coming from Korea, which is another of our large international markets. So Japan, Canada, South Korea, you know, we're slowly starting to do some reopening, as well as doing some vaccination effort, which I think we're standing close to or already past 120,000 vaccines administered out of about roughly 154. That's from the first 2 brands that have been approved by the federal government. So we're getting there, Archie, and it's slow, but I think there's still some optimistic ways ahead for reopening and vaccinating the population here.
Definitely exciting things. It sounds like that's coming for Hawaii. So happy to hear that things may be on the way up for Hawaii. So thank you so much for joining us today. Now, the
Thanks,
Ontario
Archie.
government.
Reporting from Honolulu. Go ahead.
No, continue. Yeah.
Yep, that's it. We live in interesting times. See you soon.
The Ontario government raises awareness of mental health through Bell Let's Talk Day and is encouraging Canadians to take action to fight the stigma. Eagle News correspondent Joshua Santillana reports.
January 28th is Bell Let's Talk Day in Canada. Launched 10 years ago, Bell Let's Talk aims to raise awareness and help break the stigma surrounding mental illness in Canada. Premier Doug Ford released a statement Thursday to encourage Canadians to actively participate in the conversation. Take a look.
Today is Bell Let's Talk Day. I know the COVID-19 pandemic has been tough for a lot of people. I know many are struggling with their mental health, whether that's burnout, anxiety, depression, or social isolation. I want you to know that you're not alone. If you need help, please reach out. Your mental health is just as important as your physical health.
With COVID-19 cases on the rise in Ontario and almost a year into government-imposed physical restrictions, social isolation truly has affected people's mental health. Here's Associate Minister of Mental Health and Addictions, Michael Tibolo, for more details. As we continue the fight against COVID-19, supporting those with mental health challenges continues to be a top priority for our government. That's why we developed a comprehensive plan, Roadmap to Wellness, to build a fully connected mental health and addiction system across the province. To support the plan, we provided $176 million in annual funding for mental health care and $194 million in one-time emergency mental health and addictions funding in response to the COVID-19 pandemic. In addition, the federal government announced more financial support for mental health programs in Canada. One of these investments will go towards Wellness Together Canada, a free online portal that connects Canadians with peer support workers, social workers, psychologists, and other professionals through confidential chat sessions or phone calls. Prime Minister Justin Trudeau made this announcement via Twitter. Take a listen.
As a government, we know how important mental health is to our daily lives. To make sure you have what you need to stay healthy during these tough times, we've made investments to improve mental health services for all Canadians. We've invested in Wellness Together, Canada's free online portal that will help you find the mental health resources, tools, and services you need. We've also invested in Indigenous communities to help them expand and adapt mental health and wellness services. And to make sure young people have easy access to support, we've provided funding to Kids Help Phone. As a government, we will continue to invest in mental health services. But as individuals, we can all play a role in helping break down the barriers that people face when it comes to dealing with mental health issues. We can start by being kind to one another.
In a study conducted spring of last year, more than half of Canadians reported that their mental health has worsened since the onset of physical distancing due to the pandemic. About 88% of the participants from the study experienced anxiety, with higher anxiety levels among those who have been financially affected due to the economic impact of COVID-19. As of December 2020, almost one-third of Canadians have reported feeling lonely or depressed. At the end of the Bell Let's Talk campaign Thursday, about 159 million interactions were posted on social media, resulting to an estimate of $7.9 million in new mental health and funding that will be donated by Bell. In Toronto, Joshua Santillana, Eagle News. We live in interesting times.
Now in sports, 6 months from now, the Tokyo Summer Olympics is set to go as planned. Eagle News correspondent Julia Evangelista has the details.
Despite the surge of COVID-19 cases in Japan, the Summer Olympics in Tokyo is set to go as planned in July. International Olympic Committee President Thomas Bach has confirmed, with the support of the Japanese government, the plans for a safe and secure Olympic Games.
6 months ahead of the Games, the entire Olympic movement is looking forward to the opening ceremony on 23rd of July. Everybody is really determined to make these Olympic Games in 6 months from now the light at the end of the tunnel, in which at this moment we are all still in. But all the prospects are good. We are working hard, and these games, the first priority will be about to make them safe and secure for all participants. So everybody can rest assured our first priority is safe and secure Olympic Games. And when we are talking about the measures, there can be no taboo for securing safe and secure Olympic Games for every participant.
The Olympics hope to bring courage and hope to the world. The opening ceremonies will begin on July 23. From Boston, Julie Ann Lou Evangelista, Eagle News. We live in interesting times.
That's our program for today. Join us again next week as we bring stories that matter to you. Visit our website at eaglenews.net and eaglenewslive.com, and also follow us on Twitter, Facebook, and on YouTube. Thank you for watching. I'm Archie Rose at TV Dad Yi. We live in interesting times. Stay tuned for Kid Cuento.